There's a new demographic for American mothers. According to a study by the Pew Research Center, women age 35 and up are now giving birth more often than teens. And here with more information on what the statistic means for mothers, their children, and our healthcare system is ABC News medical contributor and OB-GYN Dr. Jacques Moritz. Dr. Moritz, great to see you again.
Good being back.
So it's interesting that this trend is proven to be happening all around the country. I initially would not have been surprised to hear it happening in urban centers like here in New York. But that's not the case.
Right. I thought it was just a New York phenomenon with women with careers. But this is a huge flip-flop. So teen pregnancies way down, and pregnancies over 35 way up higher.
Right. Both very interesting things to talk about, both with their own set of consequences, right? Let's start with the older moms.
Right.
What does this mean? Is this a good thing? I mean, are women able to withstand pregnancy and motherhood at an older age?
Right. Well, the pregnancy part we have worked out. That works pretty well. Now there's going to be more C-sections. There's going to be more medical complications. There's going to be more preeclampsia. There's going to be more of that. But that should work out well. I think more interesting is the social things. Because in the study also, it came out that half of the mothers are single moms. And in addition, the single moms are also smarter moms. So what you have now is you have more women going to college, more women having careers, delaying having children, and moving it from a very young age to an old age. What does this all mean? So
within a generation, essentially, there's no longer a stigma attached to being a single mom.
50% of babies being born now are coming from single mothers. I mean, just think, that's a huge number.
Absolutely. That is some kind of watershed. And these are, like you said, educated women who presumably have incomes or good incomes.
Right. They didn't talk about incomes, but you can assume that they are, because in the older moms, 71% of them have had some college or finished college. So more than likely are having jobs. Now, what does this mean in terms of companies, in terms of ABC? Do you provide childcare? In the studio here, if you have single moms, who's going to take care of the kids?
Well, I know moms everywhere of every age would say yes.
Well, of course, except in this country, we really have our priorities kind of messed up because we don't have child care worked out. So who's going to take care of the baby when the baby's sick? Is the mom going to take off work? Huge, huge questions.
Absolutely.
And I think the study was really well done, by the way. And it's going to open eyes to companies providing services, to businesses, to everything.
So what will this mean for our healthcare system? Will it have to adjust?
Well, just think about older moms also. More amniocentesis, more invasive procedures, more bed rest. It's going to have to adjust also. In New York City, at our hospital, Roosevelt, we've already adjusted. We have a much older population. We have the kind of outliers, the group between 45 and on. And in this study, their rate quadrupled in size.
Now, there's no long-term studies to look at what these 45-plus moms are feeling or doing when their children are 30, right? So this is an unknown.
Well, let's not talk about 30. I was joking with a patient of mine yesterday because I have a lot of older moms. I said, you know, at high school graduation, you're just going to be getting your Medicare card. And I don't think it really crossed her mind, but it's true. You know, mommy's going to be getting Social Security when I'm graduating high school, not college. But these children also are going to be taking care of their parents at a younger age. So when they're in their 20s, they may be taking care of their parents.
Absolutely. Very important to recognize. Now let's talk about the flip side of all of this, which is that teen pregnancy is down. Are these two issues related?
I don't know if they're related, but that's the great news of this, that it's down about 4%, which are huge, huge numbers. And the whole thing has been shifted to the right. And the nice thing is it crosses all social barriers. Hispanic, African American, white, everything has shifted to the older age. So women are staying in school, going to college, many more are going to college, so the more educated, usually the less you want to have a teen pregnancy.
And what do you think is to account for that massive drop in teen pregnancies?
Well, I think it's educational system, women being encouraged to have jobs, understanding they can have jobs and they don't, have to be mothers if they don't want to be mothers, or that they can postpone it longer.
And that they may be expected to support the man in their lives, as so many women these days are doing. We look at the employment numbers, and the men felt the brunt of a lot of these layoffs recently, and the women are still working and supporting the families in many cases.
And also what came out of the study is the birth rate went down a little bit, and that's probably due to the economic crisis, except It didn't go up in the older moms. I'm calling older moms 35 and above. They said, listen, I can't wait for the economy to get better. Right. This is my chance. I'm going to get pregnant now.
Now, did the study look at different regional centers of the country, or this was just...
No, this was
okay.
nationwide. And that's, I think, the strength of it. And pockets in industrial, big cities, it's going to be more shifted to that side. But it's interesting. They looked at pretty much everything. Now,
is the decline in teen pregnancy going to have some kind of impact on the healthcare system?
Well, hopefully in the positive. But that goes again to another thing that they looked at. They asked a simple question. Why do you have children? And you better not ask me today with teenagers. But the answer was for the joy of having children. That's 50%. The other 50% said it just happened. So we still have this issue of, I don't want to call it unplanned pregnancy, but pregnancies that weren't really planned. That probably they were together and said, well, if it happens, it happens. If it doesn't,
but that number seems to be declining.
Well, no, not necessarily. That number stays the same. So all pregnancies in the country, half of them are unplanned. Right. Which is important because we want to fortify the foods. We want to have folic acid. We want to have everything built into our food system so that when someone does get pregnant by accident, the baby has the best chance. It's healthy.
All right, Dr. Jacques Moritz, thank you so much. Fascinating study. And for more information on pregnancy and other health issues, be sure to visit the health page at abcnews.com.